Hi, my name is Courtney. I'll be your nurse today. Can you give me your name and your birth date, please?
Anthony Jacob, December 28th, 1999.
All right. As soon as I walk in the room, I note that Mr. Jacob is in bed. He has two side rails up. There's no clutter to the bathroom or any exits. He has an IV in his left arm, and that he has no tubes or drains present. All right. So, can you give me You just told me your name, so can you give me where you are?
The hospital.
Okay, do you know what today's date is?
July 8th, 2008.
Okay. So he's alert and oriented ×2 to person and place, but he is unaware of the time and the date. His vital signs are 99.0, his heart rate is 87, his respirations are 32, his blood pressure is 123/77, and his pulse ox is 96. All right. Putting on gloves and washing my hands. Okay, so the first thing I'm going to notice is his skin color. It is appropriate for his ethnicity. It is pink, it is warm and dry. I'm going to ask you to turn your head. Okay, turn your head the other way. So there was no jugular vein distension noted. Click, click. His perla was 3 millimeters. All right, I'm going to ask you to go ahead and squeeze my hands. All right, and then can you push my hands? And can you pull my hands? Okay, so he is able to push and pull bilaterally. Okay, the next thing I'm going to do is let's do your bowel assessment. So, have you had any abdominal pain lately? No. Have you been able to pass gas?
Yes.
Are you having? When was your last bowel movement?
5 hours ago.
Okay. First thing I'm going to do is palpate his abdomen. Does this hurt?
No.
Any pain?
Nope.
Any pain?
Nope.
What about now?
Nope.
Okay. So since he denied pain, I'm going to go ahead and auscultate. Really good bowel sounds. Like I can hear them perfectly. Okay. So he had bowel sounds present in all 4 quadrants. Okay. Let's go ahead and have you sit up for me. All right. So I'm going to go ahead and auscultate his lung sounds. So every time I touch you with my stethoscope, I want you to take a deep breath in for me. Okay, I'm going to have you do the same thing for me. Alrighty. Raise your right arm for me, please. left arm. Alright, and then I'm going to listen for his apical pulse. So I'd listen to his apical pulse for a minute, and I'd note that it is 77 beats per minute. Alright, you can lay back down. Alrighty, so I'm going to go ahead and check your pulses. Alright, so he has, both pulses are present bilaterally for his radial. And then, are you having any pain while urinating?
No.
Are you having any urgency for urination?
Yes.
Are you having any discharge when you're urinating?
No.
Okay. Alright, so I'm going to go ahead and feel for his pedal pulses. They're present bilaterally and they are strong. Alright, so I noted that his abdomen was soft, rounded, and also it was non-tender. And I did not note any edema on his upper or lower extremities. Okay, and then there's one last thing that I'm going to do. Your fingers. Capillary refill is less than 3 seconds on upper extremities. And then capillary refill is less than 3 seconds on lower extremities as well. Okay. And then I will also inspect his IV site. It is not red or irritated. Do you feel like it's tender around the site? No?
No.
And then his IV is still patent. And he has normal saline running at 250 milliliters per hour with an insulin drip. And now I'll be reporting off. So Mr. Logan came in with decreased level of consciousness, rapid heavy breathing, and he had fruity breath. His blood glucose was 804. His anion gap was 29. His bicarb was 17. His pH was 7.12. And his PCO2 is 30. His urine came back for, it was positive with ketones. We started an IV on him, and we bolused him with 1 liter of a normal saline. And then we've kept a continuous infusion of normal saline at 250 milliliters per hour. We were supposed to also do an insulin drip of Lispro for his IV, and we were supposed to titrate to when his blood glucose was under 174. After that, his basic metabolic panel showed a low potassium, so the doctor ordered him 40 milliequivalents of potassium chloride orally. His pH returned to normal with normal bicarb and CO2 levels. So we transitioned him off of the IV drip and administered a sub-Q injection of insulin. And then I basically just went over to him and the family members ways like how he could correctly monitor his blood glucose and manage his insulin doses accordingly to make sure that he's monitoring his blood glucose before and after meals. And then I also instructed the family members and the patient on the signs and symptoms of diabetic ketoacidosis. And I also went over with the family when they should seek medical attention when they notice these signs and symptoms, because it can become bad very rapidly. And then I also educated the patient on the different foods that would not spike his blood sugar and that will help him maintain a safe glucose level. So, like a complex carb, like peanut butter crackers or something. So, yeah. That is all.